Analysis is based on 3 levels of spread. Individual cases are identified and managed by NHS Test and Trace. When many cases are found in one setting, be it a care home, for instance, a factory or a hospital, that is classified as a cluster, and that will be dealt with largely by the local Director of Public Health, who has statutory powers to close individual organisations. When Public Health England, or the new JBC, identifies clusters that are linked to one another, that is defined as an outbreak, and a range of local and national actions may be needed. Decisions are taken through our Local Action Committee command structure. It works as follows. If PHE or the JBC spots a problem that needs attention, or the local Director of Public Health reports up a problem through the regional health protection teams, then the outbreak is assessed at the daily Local Action Committee bronze meeting. Issues of concern are raised to the Local Action Committee silver meeting, which is chaired by the Chief Medical Officer. And problems requiring ministerial attention are then raised to the Local Action Committee gold meeting. Yesterday, I chaired an emergency Local Action Committee gold meeting specifically to deal with the outbreak in Leicester. Unfortunately, while cases in most parts of the country have fallen since the peak, in Leicester they've continued to rise. The 7-day infection rate in Leicester is 135 cases per 100,000 people, which is 3 times higher than the next highest city. Leicester accounts for around 10% of all positive cases in the country over the past week. And admissions to hospital are between 6 and 10 per day, rather than around 1 a day at other trusts. Over the past fortnight, we've already taken action to protect people in Leicester. We deployed 4 mobile testing units and extra capacity at the regional test site. We provided thousands of home testing kits and extra public health capacity to boost the local team. This afternoon, I held a further meeting with local leaders, with Public Health England, the JBC, the Local Resilience Forum, and my clinical advisors, followed by a meeting of the Cross-Government COVID Operations Committee, chaired by the Prime Minister. We have agreed further measures to tackle the outbreak in Leicester. First, in addition to the mobile testing units that I mentioned earlier, we'll send further testing capability, including opening a walk-in centre. Anyone in Leicester with symptoms must come forward for a test. Second, we will give extra funding to Leicester and Leicestershire councils to support them to enhance their communications and ensure those communications are translated into all locally relevant languages. Third, through the councils, we'll ensure support is available for those who have to self-isolate. And fourth, we'll work with the workplaces that have seen clusters of cases to implement more stringently the COVID-secure guidelines. Given the growing outbreak in Leicester, we cannot recommend that the easing of the national lockdown, set to take place on the 4th of July, happens in Leicester. Having taken clinical advice on the actions necessary and discussed them with the local team in Leicester and Leicestershire, we've made some difficult but important decisions. We've decided that from tomorrow, non-essential retail will have to close. And as children have been particularly impacted by this outbreak, schools will also need to close from Thursday, staying open for vulnerable children and children of critical workers as they did throughout. Unfortunately, the clinical advice is that the relaxation of shielding measures due on the 6th of July cannot now take place in Leicester. We recommend to people in Leicester, stay at home as much as you can, and we recommend against all but essential travel to, from, and within Leicester. We'll monitor closely adherence to social distancing rules, and we'll take further steps if that's what's necessary. The more people follow the rules, the faster we'll get control of this virus and get Leicester back to normal. We'll keep all of these local measures under review, and we will not keep them in place any longer than is necessary. We'll review whether we can release any measures in 2 weeks' time. These Leicester-specific measures will apply not just to the City of Leicester, but also to the surrounding conurbation, including, for example, Oadby, Birstall and Glenfield. I know that this is a worrying time for people living in Leicester, and I want you to know that you have our full support. We do not take these decisions lightly, but with the interests of the people of Leicester in our hearts. I want everyone in Leicester to know that we've taken every one of these decisions to protect them from this terrible virus. We must control this virus. We must keep people safe. These actions are profoundly in the national interest too, because it's in everyone's interest that we control the virus as locally as possible. Local action like this is an important tool in our armoury to deal with outbreaks while we get the country back on our feet. And Mr. Speaker, we said that we do whatever it takes to defeat this virus, and we said that local action would be an increasingly important part of our plan. The virus thrives on social contact, and we know that reducing social contact controls its spread. Precise and targeted actions like these will give the virus nowhere to hide and help us defeat this invisible killer. And I commend this statement to the House.
Shadow Secretary of State Jonathan Ashworth.
Grateful, Mr. Speaker. Can I start by thanking the Secretary of State for advance sight of the statement, and also thank him for the many direct conversations we've had in recent days about the situation in Leicester. I mean, I hope the House will forgive me if I ask a number of questions about the situation in Leicester. It is the city I represent, but I hope the House will also understand that many of the points I raise would be applicable to their own areas should they also see an outbreak in their own constituency. Now, the Prime Minister talks of his whack-a-mole strategy to suppress local outbreaks. We were alerted to the situation in Leicester 11 days ago, and now we have got from the Secretary of State tonight the whack-a-mole strategy. But does we agree that if we are as a nation to ease from lockdown smoothly, then those areas that do see flare-ups will need greater speed in the response, otherwise we risk no moles getting whacked? Ministers, Public Health England and agencies must work closely together with local government leaders. That's happened in Leicester. We are grateful for that. And local directors of public health need rapid and ongoing access to testing data. Can we resolve whatever the issues are around the data sharing protocols? So if we see flare-ups in other cities, local authorities can get data speedily. And can he look into ensuring that data, or the testing data, also captures ethnicity and occupation as well? For a city like Leicester, capturing that level of intelligence is absolutely crucial. Now, Mr. Speaker, people in Leicester were concerned, anxious and scared to read in the newspapers and see on the TV screens yesterday news that we were going into some form of lockdown based on anonymous briefings. Grandparents who had recently formed bubbles to see their grandchildren were asking me whether they had to withdraw again. Parents were asking about whether they could send their children to school today. Those shielding were particularly worried. Look, I want to say to the Secretary of State, I understand things get leaked and so on. You know, I've been around politics a long time. I understand that. But can I just urge him to appreciate that something of this seriousness and sensitivity, people need crystal clear clarity and not briefings perhaps from over-eager advisors, perhaps. I don't know. Now, he's announced a number of extensions to the lockdown measures. I support those extensions given the outbreak in Leicester. Can he just clarify what powers he has to enforce those extensions and whether he needs to bring forward any legislation or any statutory instruments? I welcome the fact that there will be a 2-week review. Will he undertake to keep the Members of Parliament updated on that, and will he come back to the House to announce the outcome of that review? This decision, though, will impact many businesses in Leicester who are currently preparing to open up on Saturday. Many feel they are now in limbo. So will they be eligible for adequate financial support for this extension period? And will employees affected be eligible to stay furloughed as well? We know this virus thrives on inequality, and a disproportionate number of Black and Asian people die from this disease. A disproportionate number of the poorest are also most likely to become infected and die from this disease as well. It means a city like Leicester is particularly at risk. He will know Leicester is a proudly diverse city, but we also have one of the highest child poverty rates in the country. Those who are in work are often in low-paid, precarious employment. Our housing is overcrowded. Our public services have been cut back. Years of austerity has taken its toll. But saving lives, keeping people safe across Leicester is always my priority, so I support the measures he's announced. But we also need extra support, extra testing, extra resources to protect people in our city as well. So I'm grateful for the extra testing stations he's put in Spinney Hill Park and Victoria Park. Will they remain in place for the duration of this outbreak? I know what he said about an extra walk-in centre. I welcome that. But could he also provide the city with thousands of home testing kits so they could be distributed to local people? I welcome the extra resources for Leicester and Leicestershire to translate literature into the many languages that we are proud of in Leicester. He will also know that for those who are asked to isolate, financial security is absolutely crucial to the success of contact tracing. So where people live in multi-generational households, which we have a lot of in Leicester, will he provide accommodation for those who need to isolate away from home? And will he also ensure that workplace inspections happen to check that people who need to isolate have not been forced back to work? And also, given that schools are closing, for people who live in Leicester but work outside of Leicester and will now have childcare responsibilities, can they be furloughed and their employment rights be secured? Could he consider giving Leicester City Council face masks to distribute to every resident? And I'm pleased that he's accepted that the extension to restrictions cannot just apply to the tightly drawn Leicester City Council boundaries, but must include the wider Leicester urban area as well. There will be many other cities and towns with similar demographic profile to Leicester: Birmingham, parts of Manchester, parts of London, Bradford, Coventry. What extra resources and testing capacity is he now putting into those areas? And what extra support and testing capacity is he putting in place to support the many occupations who are particularly at risk, like taxi drivers and bus drivers? Finally, Mr. Speaker, the World Health Organization tonight has warned that this virus is still spreading at speed and that those countries who have opened up are beginning to see a resurgence. The virus remains deadly, it causes significant long-term harm and still demands a resolute response. If that means restrictions have to remain in place, whether in Leicester or elsewhere, or restrictions have to be reimposed, whether in Leicester than elsewhere, then so be it.
Secretary of State.
Thank you very much, Mr. Speaker, and I want to put on my record my gratitude to the Shadow Secretary of State and his Leicestershire colleagues in this House, who have all worked in a constructive manner to try to make sure we get the right answers here and then we communicate them in the right way to the people of Leicester. He, after all, is both a Leicester MP and the Shadow Secretary of State. I set out in my speech the action that we've already taken over the past fortnight in order to support Leicester City Council and Leicestershire, the County Council, to tackle this outbreak. We've been acting on it since it first came to our attention. It's clear now that further action is necessary. He talks about the debate that has been in the media. All I can say is that within 2 hours of the final decisions being taken, I've come to this House, and I'm very grateful to you, Mr. Speaker, for allowing me to come at this late hour, unusually, to the House in order to set the decisions out immediately. He asks quite rightly about the powers that will underpin the decisions I've taken. They will be brought forward with a statutory instrument very shortly, and I absolutely commit to keeping the House updated on the 2-week review for whether we can lift some of the measures. He's quite right to talk about the proud diversity of the city of Leicester. And it is very important that in how these decisions are communicated and how the public health measures are undertaken in Leicester, that diversity is taken into account, including, for instance, the financial support we've put in place for the translation of these messages. On some of the specific questions, he asks if the testing units can be there for the long term. They will absolutely be there for as long as they're needed. He asked for the provision of home testing kits. Mr. Speaker, I will take that away, but I can commit to him that we will increase the number of home testing kits available for Leicester. He asks about accommodation for those who are required to self-isolate but whose accommodation doesn't allow for it in practice, and we are working with the City Council to put in place the availability on a discretionary and exceptional basis for accommodation for those who are required by the public health officials to self-isolate. He asks about the question about childcare. Of course, I appreciate these decisions, especially the closure of schools, will have an impact on working parents. Childcare, of course, is a reason for essential travel, and I hope that during the broader lockdown across the country, people will be able to make arrangements for childcare. Finally, Mr. Speaker, he asked about other areas which also have a high intensity. And we are, of course, looking across the country at the cities where this virus remains higher than elsewhere. However, the number of cases in Leicester is 3 times higher than the next highest city. And what I'd say is that that is not only due to the fact that there's now more testing in Leicester, because if it were, you would see the proportion of people tested who test positive, you'd see that proportion falling if it was just that there's more testing that's gone in. Actually, that proportion has remained static, which is one of the reasons that we're concerned, specifically concerned about Leicester. So it is not just the increased testing, it is that there is a higher prevalence in Leicester, and that's why we've taken the actions that we have.
So the Select Committee, Jeremy Hunt.
Thank you, Mr. Speaker. I support the actions being taken in Leicester, but like the whole House, feel for the people of Leicester at a particularly anxious time. I want to ask the Health Secretary about the broader matter of testing of NHS staff, because he has said many times he supports routine testing of NHS staff. But last Wednesday, the day actually we debated this issue in this House, a letter went out to the NHS saying that testing of NHS staff was going to be based on PHE's Siren study, which is the antibody testing programme. Given that it takes up to 3 weeks for an antibody to show, how can a regime that is meant to stop the asymptomatic transmission of the virus to patients and colleagues before they manage to transmit it possibly work?
Thank you very much. The regime for testing NHS staff, which will apply in Leicester and right across the board, that regime is the one recommended by clinicians. The Siren study not only starts with an antibody test, but then has regular it starts with an antibody test, but then has regular swab testing, including at weekly frequency, within it. So you get the regular testing to find out if people have the virus, also the test at the start to find out if they've had it, and that way you can not only make sure that you're keeping them safe and finding out if they've got the virus, but also it supports the immunology research to find out if people who have antibodies then catch the virus a second time. So it's in order to get both the practical benefits and the research benefits that we're doing it this way.
Heading to Scotland with the SNP spokesperson, Dr. Philippa Whitford. Dr. Philippa Whitford.
Thank you very much, Mr. Speaker. Naturally, I too am delighted that Scotland has had no deaths for 4 days and only 5 cases today. Public Health England began publishing combined data from commercial as well as NHS labs at the beginning of this month. Since then, it's become clear that Leicester has had far more COVID cases than they were previously aware of, with almost 900 over the last 3 weeks. This data is only published on a weekly basis, however, which is of no use for tracing contacts or early identification of an outbreak. The Secretary of State tends to focus on the number of tests, but does he accept it's actually tracing and...
What has been done to encourage others to be safe in exercising their religious and civil liberty?
Well, thank you very much, Mr. Speaker. I know that right across the whole of the United Kingdom, people have given up on events that they hold dear to them, and that is a sacrifice. And tonight, Mr. Speaker, we're asking the people of Leicester to take further difficult action. I appreciate very much that the decisions that we've taken have led to people not being able to enjoy life in the normal way. And I hope very much that by cracking down on the disease in the way that we've been able to across the country, and then where there are local flare-ups, by taking decisive action, we will be able to get this country as much back to normal as possible so that people can do the sorts of things they love.
Deanna Davis.
Thank you, Mr. Speaker. My thoughts go out to the people of Leicester for what must be a very worrying time, but I'm genuinely grateful to the Health Secretary for taking such swift action to tackle this local outbreak. I know that many of my constituents will welcome being able to spend more time with family, friends, and to visit restaurants and pubs for the first time in far too long, like the Eden Arms in West Auckland. So will my right honourable friend assure the House that some restrictions may be put back in place if local outbreaks are shown to be the case and identified in order to keep people safe?
Well, Mr. Speaker, yes. Today's action demonstrates that we are willing to take action to protect people, and local action in concert with the local council is sometimes what's needed. And what I'd say is that there have been local outbreaks thus far. For instance, the one in Kirklees, which, along with Kirklees Council, to whom I pay tribute, they managed to tackle that problem in one particular factory effectively, and it didn't lead to onward community spread. Likewise, the outbreak in Weston-super-Mare, where they closed admission to the hospital, they tackled the outbreak, and it didn't lead to community spread. In the case of Leicester, unfortunately, the outbreak has led to community spread, and that's why we've had to take the wider action that I've announced today.
Munira Wilson.
Thank you, Mr. Speaker. The Secretary of State said that data has been made available to public health officials in Leicester, but the reports yesterday were that actually that's been quite late in coming. Talking to local government colleagues in Kirklees, they are still struggling to get really granular data at a street level. If we're going to rely on local authorities and local public health officials to manage this outbreak, we need postcode-based data so that outbreaks on a street, on an estate, in a ward can be picked up very, very early and dealt with, and preferably broken down by ethnicity, given the demographic issues that have been highlighted in Leicester. Why is that not available now, in real time, as the member for Central Ayrshire said? What is the problem with making that data available immediately at that level?
Mr. Speaker, that data is available to directors of public health in local councils who have signed a data protection record, and I'm committing to the House to publish it at as local a level as possible so that everybody will be able to see and analyse that data.
James Sunderland.
Mr. Speaker, it was right to ease lockdown, as we must get the economy breathing again. But it's also dispiriting to see packed beaches, passengers without face masks on public transport, and other mass gatherings. Given that the government will no doubt get blamed for any second spikes, could I ask the Secretary of State how serious he is about imposing similar measures more widely beyond Leicester?
Well, Mr. Speaker, I think people will have seen from the action that we've taken today and announced tonight that although I don't want to take this sort of local action, we are perfectly prepared to take it if that is what is needed to control this virus. And throughout the lifting of the lockdown measures, our plan has been to lift the national measures and have a more targeted approach, whether that's a targeted approach at an individual case where NHS Test and Trace will then contact all those who have been in contact with that person who's tested positive. So that's a more targeted action. Whether it's an individual cluster in one setting, for instance, as was mentioned in the previous discussion around the factory in Kirklees, which was then addressed at that level, or indeed a wider outbreak, as demonstrated by the action tonight.
Heading up to Saddleworth to visit Debbie Abrahams. Debbie Abrahams.
Thank you, Mr. Speaker. Mr. Speaker, the age standardised COVID mortality rate for severely disabled men is nearly 200 per 100,000, and for severely disabled women is over 141 per 100,000. This compares with death rates of 70 and 36 per 100,000 for non-disabled men and women, respectively. I believe that when poverty is factored in, it will show even higher death rates for disabled people. So will the Secretary of State undertake an immediate analysis on the impact of COVID on disabled people living in poverty? And will he speak with his counterpart in the Department for Work and Pensions on releasing data on the disabled Social Security claimants who have died during the COVID pandemic? As to date, these data have been very, very limited.
Mr. Speaker, I'm absolutely determined to address the questions and the impacts of COVID on those who live with disabilities. I think that the point that the Honourable Lady raises is an important one, and this will form part of the work that we're doing on inequalities and the response to COVID, and that's work that the Minister for Inequalities is taking forward.
Mr. Rangani.
Mr. Speaker, can my right honourable friend share what factors lie behind the infection rate being so high in Leicester, whether those factors will be shared with local resilience forums like mine in the South East so they can also prepare? Secondly, my right honourable friend said that children in Leicester were particularly vulnerable. This is not normally the norm for COVID, so is this a separate strand of COVID, or can my right honourable friend share why the youngsters in Leicester are so vulnerable?
Thank you very much. To be clear, children have very, very low risk of suffering from COVID themselves, but we have been looking at the proportion of children who have tested positive and therefore may be transmitting the disease. The challenge with this disease with children, thankfully, it has a very, very low risk to any individual child in terms of them becoming ill or worse, but it still transmits through children, and that's what the reason that we've taken the decision that we have on schools in Leicester. Of course, there are many reasons and potential reasons why this outbreak has occurred in the way it has in Leicester. We're still getting to the bottom of those, but I absolutely undertake to then ensure that other directors of public health and local areas understand those reasons so we can get to the bottom of them. For instance, we're doing work specifically on food processing factories, which around the world seem to have a higher rate, including not only in America and Germany, also in North Wales. And of course, there is a challenge in the community to ensure that we understand properly the origins and the spread of this outbreak in Leicester, and then also look at similar cities where thankfully the case rate is much lower, but make sure that we learn the lessons for other similar cities, precisely as the Shadow Secretary of State said.
11 withdrawn, so go to Faye Jones.
Thank you, Mr. Speaker. My right honourable friend has mentioned the outbreaks in Wales. Would he agree with me that the Welsh and UK governments working together would be beneficial for everyone, particularly on Test, Track and Protect, but particularly for my constituents in Brecon and Radnorshire who share a border with England?
Yes, I know the Welsh borders extremely well, and my honourable friend is quite right to raise this issue of the need to work cross borders. We work as closely as we can supporting the Welsh Government, for instance, supporting them with their testing capacity and within Test and Trace as well. And we're working on better data sharing between the two governments, not least because of the importance for those who travel over the border.
13 withdrawn, so we come to Dr. Andrew Morrison.
Speaker, I can get a routine blood test result back same day, no problem. But a swab test typically takes days and not hours, severely limiting its usefulness as a public health tool, as the Honourable Lady for Central Ayrshire described. Does my right honourable friend believe that directors of public health should have access to comprehensive data sets in good time if they are to identify the clusters that he envisages in his statement?
Yes, absolutely, in real time, effectively.
Heading back to Greater Manchester, Barbara Keeley.
Thank you, Mr. Speaker. As the Secretary of State has detailed, when areas are put into local lockdown, businesses will have to close, including some which have probably been preparing to reopen this week. So can the Secretary of State confirm that any business impacted by a local lockdown in Leicester and other areas in future will be able to access the furlough scheme as it currently exists, rather than having to subsidise the wages of staff who cannot work?
Well, of course, the furlough scheme is available, as it is across the country, and we've also, in addition, provided the councils in question, both Leicester and Leicestershire, because some of the affected area is in the conurbation of Leicester that is technically in Leicestershire. We've provided those councils with support for them to use at their discretion for this sort of purpose.
Scott Benton.
Thank you, Mr. Speaker. Whilst I welcome the fact that people have been able to make use of open public spaces during the recent warm weather, I've been shocked at the behaviour of a small number of visitors to Blackpool who have left our lovely beach strewn with litter and who have not been observing social distancing rules. Will my right honourable friend join me in reminding people of the need to be considerate of others and to obey the current rules at all times?
Mr. Speaker, my honourable friend speaks for Blackpool, and he has a clear voice that people should listen to. And the message that people should take away is this. To defeat this virus, we need to stick together and follow the social distancing rules. And that's as true on a beach in Blackpool as it is anywhere else in the country. And people should also, if they do go out and enjoy the beach on a day of good weather, not just follow the social distancing rules, but follow basic decency and take their rubbish home with them.
Heading to Kingston upon Hull with Dame Dinah Johnson. Dinah Johnson.
Thank you, Mr. Speaker. Data is obviously vital to how we tackle COVID-19, and we see that this evening in what's happened in Leicester. But could I ask the Secretary of State, why is it for 39 days that the government have not been able to publish the number of people tested for COVID-19, and why can't the public know how many people have been tested in their local testing centres like the Humber Bridge car park testing centre up in East Yorkshire?
Yes, we are publishing more data on the where tests are done and where those positive test results are based, in order to understand better the clusters. She's on the point she's referring to on the number of people testing. There's a long-standing issue in terms of the deconfliction of and understanding the difference between understanding and making sure we get those data right. We're working with the UK Stats Agency on resolving the problem, and I hope to have it resolved as soon as possible.
Sir Graham Brady.
Mr. Speaker, at the statement on the 18th of May, my right honourable friend confirmed to me that he was working on measures to support care homes that are in financial difficulties. I wonder when he will be in a position to publish what those measures will be. Clearly, a lot of care homes are facing significant difficulty right now.
Yes, I'm working with my right honourable friend, the Community Secretary, and also the Chancellor of the Exchequer on exactly those measures.
Heading up to Scotland to visit Martin Day. Martin Day.
Thank you, Mr. Speaker. Sir Jeremy Farrar, who sits on SAGE, said that in winter we anticipate rebounds and second waves, and said it's crucial to get to the type of position that Scotland is in, with low numbers of cases giving a low base to tackle local outbreaks. With 901 new cases reported over the last 24 hours, how confident is the Secretary of State of reaching this low base by winter?
Thank you very much, Mr. Speaker. Well, clearly, the measures that we have in place are there to bring the number of cases right down, and we've been able to do that over the last few weeks, since the middle of April when we saw the peak. And that's been happening across the country, and where we do see local outbreaks and see that trend going into reverse, we're able to take action, whether that's on a highly localised level around a single cluster, or as demonstrated tonight with an outbreak like in Leicester.
Robert Courts.
Thank you, Mr. Speaker. I welcome the decisive action taken today and the statement from the Secretary of State. There will, of course, be some nervousness amongst the country at large. So would he reassure people that lessons are being learned in real time and passed on to other local areas as they happen, and also that if it's necessary for him to go further to control this virus, that's what he'll do?
Yes, I can absolutely confirm the point about the lessons being learned and then promulgated to other places around the country, not least because we want to empower local councils to be able to look out for a flare-up themselves, and then to escalate that straightforwardly in the process that I outlined in my statement. We'll be publishing shortly more details on exactly how that process works, and I absolutely agree with him and will commit to this House that if further action is needed, whether in Leicester or around the country, we are not enthusiastic about taking that action, but we absolutely will if it's necessary.
Tricia Gibson.
Mr. Speaker, future lockdowns where necessary. It must be decisive and prompt, and they of course depend on public compliance. But in practical terms, can the Secretary of State give us a bit more detail about how they will work? For example, the furlough scheme pays 80% of wages during lockdown, and it's due to be rolled back from the 1st of August. Can he confirm that in local lockdowns after the 1st of August, wherever they are required, 80% of furlough support will be available in order to assist with lockdown compliance, which is so important for public health?
Well, of course, as we move from a national lockdown towards local lockdowns, we are going to have to take more specific action. For the time being, and for Leicester, the existing furlough scheme, of course, exists.
Christian Wakeford.
Thank you, Mr. Speaker, and I thank my right honourable friend for his statement. The majority of this House, and indeed the country, will be looking forward to some additional freedoms as of this weekend. I myself am looking forward to a pint of paper maker at Radcliffe Market. The hard work and sacrifice of the British people have got us to this point. So will my right honourable friend join me in urging everyone out there to not only maintain social distancing, but to stay alert and make sure that this hard work is not undone and restrictions reimposed?
Mr. Speaker, my honourable friend is absolutely right and speaks with great wisdom that whilst we're able to lift some of the lockdown measures, and whilst people will be able across most of the country to be able to exercise some more freedoms, like the freedom safely to go to the pub from this weekend, we've got to be aware, all of us, that this virus still lives in our communities, and we must continue to tackle it, and we must continue to stay alert and so control the virus, because that saves lives.
Wendy Chamberlain.
Thank you, Mr. Speaker. If we want to make local lockdowns work, we must ensure that people and businesses get the economic support they need to get through a further outbreak of COVID. And that does mean making furlough available where it's needed. And I hope the Minister will also recognise that this means providing targeted relief for businesses which are affected. My colleagues in Scotland have this weekend proposed a VAT holiday for tourism businesses affected by COVID. But will he speak to the Chancellor for providing similar targeted measures for those sectors which are shut down under a local lockdown?
Thank you very much, Mr. Speaker. We are providing funding for local support, but I just want to reiterate to those who are in Leicester right now and listening to this to this debate that the furlough scheme is in existence, and it works now in the same way that it's worked across the country.
24 is withdrawn, so we're heading to Ealing North with James Murray. James Murray.
Thank you, Mr. Speaker. Ealing Council, which covers my constituency, is one of those who are concerned about receiving all the data they need as quickly as they need it for local outbreak plans to work as well as possible. So will the Secretary of State guarantee that full testing data will be shared with every local authority, GP and Director of Public Health, and commit to there being no time lag between these tests being carried out and the data being shared?
Yes, Mr. Speaker, that data was made available last week to all councils, subject to a data protection agreement, which the vast majority have returned.
Final question, Alberto Costa.
Thank you, Mr. Speaker, for calling me as the MP for South Leicestershire, an area directly impacted by my right honourable friend's statement this evening. Would my right honourable friend confirm that the funding that he's promised Leicestershire County Council and Leicester City will also be split for the affected district councils like Blaby District Council? And will he also explain what impact areas outside the city of Leicester, because he keeps mentioning Leicester, but what areas in Leicestershire have been impacted by this statement?
Yes, absolutely, Mr. Speaker. We will be publishing the exact details of which wards are included in these measures imminently. That's a decision that's being taken by Leicestershire County Council along with PHE. And I understand the call for support, for financial support, both for the district and borough councils as well as for the county council. In the first instance, that funding will flow through the county council, but I will absolutely look at the point that he's raised.
That completes the statement. Thank you, everyone. Point of order, Alison Thewlis.
Thank you very much, Mr. Speaker. Earlier, the Parliamentary Under-Secretary of State for the Home Department, during the responses that he had to my urgent question, stated that no confirmed cases among people living there are no confirmed cases among people living in Glasgow hotels of COVID-19. Mr. Speaker, I have a constituent who has been in a hotel in Glasgow city centre who has had COVID-19 diagnosed. Is there a way of putting on the record that, that the Minister earlier has perhaps had the wrong information provided to him to say that no people have had COVID-19 in hotel accommodation? And would he be able to ask the Minister to come and correct the record? Because my constituent certainly has had COVID-19 and has isolated in a Glasgow city centre.